Good morning, Joy.
Good morning.
Actually, it's good evening here for my time zone. So we have 12-hour time difference. But it's very happy to see Joy again. And today is our first episode to talk about what Joy learned from the IUGA conference last month in Brazil. And for today's topic, we would like to talk about the pelvic floor recovery after birth and what we can actually do through evidence-based practice. So, Joy, would you please say hello to the audience and let's talk about more about the pelvic floor injury after birth. Okay?
Yes, hello everyone, and thanks again to inviting to the beautiful episode, which is we talking about the things what we should understanding better about in terms of pelvic floor health is related birth. So yeah, I want to really like to share updated latest information what I learned from IUGA this time. I'm excited about it.
Okay, so Joy, after looking through the IUGA slides you shared with me, I realized that they made me think differently about pelvic floor recovery after childbirth. I would love to hear your biggest takeaways from the meeting. For women who are listening today, what would you like to share the most important message from the latest evidence?
Yeah, that's good question. Well, I'm also working daily basis with pregnancy and postpartum as clinician. My practice also shifted after attending a yoga because the education level also different, information is different. I think this is the biggest shift, the information what I've got from my yoga this time is the birth injury is not simply just muscle tone or not torn. It's more biological dynamic process, which is we can do a lot of more as not just, oh, you have injury or not, or you have a symptom or not. We can have variety understanding what's going on in your pelvic floor system, and then how we can help their functional regain properly with support a lot of healing process journey. So that is big message from I learned this time at yoga.
Okay. So, for many years, people thought pelvic floor injury was simply about whether the muscle was torn or not. So, after attending our yoga, so it seems that the understanding has changed. So, would you please talk us more about, like if we see a postpartum woman and she has some symptoms, maybe with pelvic floor dysfunction. So what should we ask her or explain to her what happened to her body?
Yeah, so that's really key before we want to understanding to how much or how severity of the pelvic floor injury. Especially we really focus on aversion, which is the terminology is pelvic floor muscle attachment is like the attached. So we as PT or medical provider, like with imaging, some MRI or like ultrasound, do you want to detect the kind of the severity of the pelvic floor aversion situation? But as I mentioned, this time with more animal study and more basic science, what they find, it's more than just muscle torn, and such as this is more variety, more spectrum injury. It could be your microscopic muscle fiber injury or connective tissue, strain, also muscle strain or nerve damage. Yeah, which is same as sports injury. When we think about some people just got, injured, some body part, we think about the way more, the variety spectrum of injury component, but we didn't think about pelvic floor injury that way. So, but this time we discover that pelvic floor injury is more than just muscle torn. So multi-system, multi-tissue involved, which is more spectrum damage.
Yeah. So it should be like we see pelvic floor as a system, not only a single tissue like muscle or tendon or fascia or ligament. It should be a complex system.
Yep.
And also involve the motor control, and also involve the intra-abdominal pressure management from the postpartum women.
Yeah, that's why. Yeah, so that's also along with the recovery process, which is the recovery is not just the regenerate, muscle tissue itself, and also very interesting finding. Some basic researcher, they find it's more than they really hard to find the muscle regeneration, but they find that the scar tissue, which is more the formation of the scar tissue that's affect the structural better support. That was a very interesting finding this time. So and with that, all people, their healing journey is very different. With their age, genetics, or their connective tissue, their health, and nerve function, and which is that all kind of the soft tissue recovery as we have provider, we can support better with a lot of kind of education and rehabilitative practice, right?
Yeah, that's so true. So like we can see some mothers, they recover pretty well, but some are very struggled with their recovery. So they may have different questions that why. So as you mentioned, they may have different age, genetics, and maybe even the parties also differ. And the daily loading, their daily activities may also make the difference.
Yeah, exactly.
Yeah.
So, yeah, and I also got a lot of questions like, oh, my friends, which is I live in Brooklyn. I working with people in the Brooklyn in very the family oriented community. So they have a lot of their friends also gave birth and same time, and they see different recovery. Some people have incontinence or pressure or more symptom, but other woman is no symptom. They feel like why that happened, but makes sense. They're all birth and pregnancy and birth experience are totally different, and also their recovery capacity also all very individual differ, and so which is we have to understanding so many the spectrum difference between each individual, but the key point is every that symptom risk factor or contributing factor is modifiable. That's the things I want to just share with all women. We can absolutely to modify that any risk factors from the beginning of the birth to and also the birth, and also after recovery with our different practice.
Yeah, so that's so true, because the even women have very smooth delivery, the postpartum care is also very important and may contribute the pelvic floor dysfunction too. I have seen cases that there is some tradition postpartum care, they will use very tight bandage things that make the abdominal very they say that it will lessen the prolapse things, but actually they make a lot of intra-abdominal pressure with the tight bindings. So when they still have wound in the perineum, they may recover they may hazard the recovery, the healing of the wound. So they may have pelvic floor dysfunction because of the bandage things. So
Yeah.
as you mentioned, it's multiple factor. So it takes a lot of education for the pelvic floor care to avoid
Yes.
the injuries.
Totally.
Yeah.
Totally.
Yeah. So also people will ask, what if the vagina deliveries seems cause a lot of issues in pelvic floor? What about C-section? If we directly choose C-section, can we avoid all these pelvic floor injuries? So how should we think about that?
Well, I think that question is the most common question like I've heard my practice. So, and people got a lot of fear about the vaginal birth because pelvic floor dysfunction as well as injuries. So, but it's not about is good, what is the good birth or bad birth. What we have to better understanding, cesarean section, that doesn't mean is we eliminate to pelvic floor dysfunction. Like pregnancy itself, it's a lot of kind of the load provided pelvic floor. That itself is, that's big contributor of our pelvic floor dysfunction. So I think it's the most important thing for women, like either what they choose, like, vaginal delivery or cesarean section, how we prevent and prepare to the pelvic floor health before birth, and also how we support our healing process afterward. I think this is the most important things the woman know. It's not just like the the bad birth and the good birth.
Yeah, that's very good answers, because for the vagina deliveries or the cesarean section, it's not so simple. Just choose one of them. They are also like the contributing factors are multiple, and even if we go through one of the delivery method, we should focus on the recovery instead of the failure, because
Totally.
the process may have very different result of multiple parts of our bodies. So instead of just focusing on the pelvic floor dysfunction, I think we have a lot of to discuss with your physician and think about what we can prepare for the recovery. Not only for the I don't want this, I think that's terrible. We should know more about the process, and even the pregnancy itself is a lot of loading to our pelvic floor. So I think many things is still under research. So we cannot just jump into the conclusion is that which one is better. I think that's not a good result. Go into the result, just put it into the yes or no questions.
Yeah, because I'm working with the woman, which is like educational and also highly interested in the prevention of pelvic floor. I haven't seen like many of women in my clinic, my client. The pelvic floor is just after birth. I just turned 1 degree. Yeah, and 2 degree. And then I feel so fine. And after birth, I feel so comfortable. I love to hear that kind of message. Someone who proactively addressed their pelvic floor health, before their birth, during the pregnancy. So highly possible.
Yeah. So, as we discussed, if we cannot change some of the factors like our age or genetics, or we have already have the childbirth, so what are the biggest modifiable factors after childbirth? What can women actually do?
I love that question because, this is like really, the things is, women have control of their body, like what I can do for me. I think that's very important to educate women what they can do for themselves. So when we think about pelvic floor health, I don't think I really don't like to think like pelvic floor just Kegel. And pelvic floor physical therapy also Kegel, rehabilitation just Kegel, absolutely more than that. So, pelvic floor health, we have to think about, of course, it's like the strength is very important, but it's bladder health, bowel health, and the sexual health, and how to pressure system management, and how to breathe, what their posture, what their movement, how they live, how they stress manage, how they recover very well. So way more things we can make pelvic floor be more happier and then healthier. So I think this is one of the practical thing I want people think bowel management, which is like a lot of people suffering the constipation, this is also one of the risk factor to keep just press down and low down. So just managing the constipation and maintain just a good bowel health, and simply just practice like the toilet technique. I'm sure you already just teaching people out there. Yes. So, and also the breathing also very important, how they breathe, and also not only also pressure management is not just not lifting too heavy weight, how to lift and the way to lift, with the kind of proper body mechanics, that the whole influence to pelvic floor load, and then daily basis we can support ourselves with just practice little by little that component.
So there are so many things to learn, like the constipation things may be related to the diet, the water intake, and the exercise. And so many things we should like educate the patient, and they have to learn to change their lifestyle. So I think for the pelvic floor, pelvic health, of course, it's more than only Kegel things. We should like educate the patient a lot of things to modify, to change. And when they experience the good results from their change, I think it will make it a lifelong health thing issues for the even the postpartum period. It should be like a lifelong issue.
Yeah, exactly. That's why I love the new YouTube channel,
The
like
new
the
YouTube
food,
tips.
diet. And
Yeah.
also love to see also the the belly dance, and that's the life. And exactly the what we eat, how to move, and what kind of fun in our life is like, I think this is a huge contributor.
Yeah, thank you. So Joy is talking about the series in my YouTube channel. So I actually combine the pelvic health with the like belly dance things. So we can demonstrate some simple belly dance movement to help people to know how to move their pelvis with the dancing. And also another series is about cooking for pelvic health. We'll talk about like the fiber diets, and also how to avoid bladder irritants during the series. So if you are interested in the knowledge more than just talking things, you want to do something more, you can watch the series about the cooking for pelvic health and belly dance with pelvic health. Okay, so the last question. So if every woman listening remembers just one thing from our episode today, what would you want it to be?
Well, I think this time one of the biggest takeaway I learned from IUGA, we should move away from fear and move toward understanding. So instead of asking what was damaged like this or pregnancy and birth, I think we should also ask how can we support our healing with different type of practice. So and also as rehabilitation provider, our role isn't just to treat the symptom, after they appear, that happened. So also, I think it's very important to help the woman be better prepared before childbirth, and then guide them to recover like properly after delivery, and support kind of pelvic health throughout, like it's not only this time, every stage of life, and which is all the lifelong pelvic health. So that's what evidence-based pelvic floor rehabilitation is really about.
Yeah. So I think for the pregnant woman, the pelvic rehabilitation should not begin after birth or after the symptoms appear. It should begin like when they are pregnant or they are preparing to be pregnant. So we can have a lot of things to educate, like how to manage the load and how to use your pelvic floor and how to combine with your breathing. And also the diet, the exercise things are also super important. So with education and appropriate rehabilitation and healthy movement habits, women can often improve their symptoms and return to the activities they enjoy. Yeah, thank you. Thank you so much for today's sharing. Yeah, so today is only the first episode. We would like to talk about the IUGA, and of course we have so many things to talk about afterwards, and also from the IUGA for the next episodes. So we'll see you next time on Beyond Silence.
Yes, I'm excited already. Our next episode.
It's okay. See you next episode. Have a nice weekend.
You too. Take care.
Bye.
Bye.